Hey everyone, Christie Tippett from Yates Fieldhouse here. For this week's A&P crash course, we are diving into my personal favorite muscle group, our quads. So as you may figure, quad means four. So in regards to our muscle group, there are actually four muscles that make up our quads. These four muscles are our vastus lateralis, vastus medialis, vastus intermedius, and then our rectus femoris. I know they sound a little scary, but don't worry, we're going to dive into it and kind of simplify those names and locations. So for vastus lateralis and medialis, last week we talked a little bit about anatomical terminology, including medial and lateral. So I'm going to kind of bring that into this session as well. So as we discussed, lateral means away from that midline or center. And then medial means towards that midline or center. So when we're talking about your vastus lateralis and medialis, I'm going to stand up and show you guys kind of on my thigh. So this is your quad right here, your anterior thigh, so the front part of that thigh, okay? Your vastus lateralis, so again, away from that midline, is right here, okay? This muscle is on the outside, kind of lateral. And then on the opposite, your vastus medialis, as you can imagine, starts towards that midline. And then it actually does underneath all the skin and all of that crosses over. However, again, this is the muscle that's medial and crosses over. And then the vastus intermedius, right? We have the lateralis, the medialis, and then we have the intermedius. And the intermedius is actually right in between those two muscles. And then last but not least, we have the rectus femoris, which is also actually in between those muscles, except it originates a little bit higher there. And we're going to get into that. So what your vastus lateralis, medialis, and intermedius have in common is that all of them originate on that upper third of your femur. What is your femur? That's that big, thick, long thigh bone, okay? So again, all three of those muscles originate in the higher area of that femur, whereas your rectus femoris actually originates on your anterior, inferior iliac spine of the pelvis. What does that mean? Those are basically really fancy words that mean anterior, front, inferior, bottom of your iliac spine of the pelvis, right? We know our pelvis is kind of those hip bones and that whole, it almost looks like a butterfly structure of our hips. So again, your rectus femoris originates on the anterior front side, inferior bottom part of the iliac spine of the pelvis. Very nice. Okay. And then what all four have in common is where they insert. So believe it or not, all of these muscles insert either at the base of the patella, that kneecap, fancy word for kneecap, or what is called your tibial tuberosity. So just fancy words. Like I said, we're going to simplify everything in this crash course. So your tibia is your shin bone, and your tibial tuberosity is basically what people call kind of the nose of your knee, this little bump right here. That's your tibial tuberosity. So your quads insert into, again, the base of your patella or kneecap, or right at this tibial tuberosity. So as you can see, these muscles are pretty long. They actually take up almost your entire femur, which is really cool. So the main function of your quads is to concentrically accelerate knee extension, which basically just means extend your knee and your leg, okay? So if you think about it, I'm gonna stand up again. When you contract or squeeze your quad, so right here, right, my quad's relaxed. As soon as I squeeze and contract this quad, what happens to my knee? It extends, right? Remember last week we said extension is increasing that joint angle. So when I squeeze and contract that quad, my knee is extending, right? Common exercises for our quads include so many different variations of squats, whether it's narrow, sumo, plie squats, regular squats. There's so many options out there, we all know this. Or lunges, or even everyday activities that you might not realize that you're actually utilizing your quads because you're not thinking about it, or you may feel as if there's not a lot of strain or effort into it. But regular everyday activities such as picking up a laundry basket when you bend over, sitting down on a chair, standing up from a chair, walking even, those are kind of common everyday activities where we utilize that quad muscle group. Okay, and then one very common stretch for quads is a standing quad stretch. So all you have to do is stand your feet shoulder width apart. You are going to grab the top of that foot where your shoelaces are or would be, and then try and bring that heel to your bum here. As you do this, you want to ensure that your knees are closer together, if possible, keeping that back nice and straight. And then you do have the option of deepening this stretch very simply by pushing those hips forward very gently. And you'll feel this deepen the stretch of the front of that thigh or quad. Perfect. So that is one of the most common quad stretches. A lot of individuals are quad dominant, meaning their quads are much stronger than their hamstrings, and that's okay. We're going to talk next week about those hamstrings and how to strengthen them. So that is all I have for today. Thank you guys so much for tuning in to learn a little bit more about those quads. I hope you enjoyed, and I look forward to seeing you all next week.